Right, so let's just get right into it. This presentation, we're going to go over Medicare education. This is not going to be specific to any kind of private plans. I'm just going to go over what your options are on Medicare, and that after you get Medicare, then you can go into more uh, precise analysis of your particular situation based on your doctors, your drugs, how you travel, etc., etc. So let's get going. And again, this is not by any means sponsored by the federal government. I myself, Matthew Regudo, am not a public servant. I am a private citizen who does Medicare insurance as his full-time job. All right, let's get into it. So today, what we're going to cover are when do you sign up, what original Medicare is, your Medicare plan options, Part D and drugs, and of course, things to consider. When do you sign up for Medicare? In Medicare enrollment, today I'm just going to talk for those of you who are 65 and older enrolling. There are two other groups of people who can enroll in Medicare. Those are people who have certain disabilities that are under the age of 65 and folks with end-stage renal disease. But as again, for this video, we're just going to go and address those of you who are turning 65 or are retiring. So you have an initial enrollment period, and that is when you are turning 65. You have the 3 months prior, the birth month, and the 3 months after your 65th birthday to do what's called, or to enroll in what's called the initial enrollment period. The general enrollment period happens between January 1st and March 31st, and this happens if you were to miss your initial enrollment period. You can qualify to sign up for Medicare during this time. If you do, your coverage starts on July 1st. Even if you enroll during the general enrollment period on January 1st, your coverage doesn't start till July 1st. So make sure you don't miss that initial enrollment period if you don't have medical when you are turning 65. The last bullet point here is the special enrollment period. That's where most people fall in if they're continuing to work after they're 65. The special enrollment period happens anytime that you're employed and you're over the age of 65. You can utilize this enrollment period. And what that does is it allows you to sign up for Medicare when your group coverage or when your employer coverage disappears. For example, if you are quitting your job in November and you want Medicare to start in December, you can do that. Unlike if you waited till the general enrollment period, you actually would have to sign up for Medicare following year in January, and that Medicare won't start until July 1st. So be sure to know which enrollment period you can qualify for and not miss that special enrollment period if you are qualified for one. So how do you sign up for Medicare? If you're already collecting Social Security, like if perhaps you signed up early for your Social Security pension, your card will automatically come 3 to 4 months before your 65th birthday, and you'll automatically be signed up for Parts A and B. If you want to withhold your Part B and not start it yet, you have to mail back the card and let them know that you do not want Part B. But for most folks, you're going to want Part B if you don't have medical. So if you're not collecting Social Security, but you do want to sign up for Medicare at age 65, up to 100 days before your birth month, you can call the Social Security office or sign up on Medicare.gov. I suggest going onto the link here on the screen or down below to find the local Social Security office, because then you can call someone who is local to your area and get them started on your enrollment and have them appoint an agent who could be locally, which might make it easier for you to work with someone. The other way is, of course, to sign up on Medicare.gov and link your Social Security government login or account so that you can sign up for Medicare electronically. Original Medicare. Original Medicare actually started in 1965. Now, I know you don't want to learn too much about the history, but it's been in effect for quite some time. It's probably the longest running American medical program, and it has two parts, Parts A and Part B. Part A covers hospital, and Part B covers medical. You can also get a Medicare supplement plan, and those plans vary A through N, or you can get a Medicare Advantage plan, also called called Part C. And once you have this basic coverage, you can purchase supplemental coverage, a Medicare supplement plan, or do a Part C private Medicare plan. All right, so let's go first to Part A. Part A only covers hospital, well, hospital and nursing care. So Part A typically is free, but as you can see here, if you work less than 30 quarters, you actually have to pay $471 per month as of 2021. If you had anywhere between 30 to 39 quarters though, that drops to $259 per month. If you meet that 40 quarter minimum though, Part A is premium free. Now what does Part A actually do for you if you go to the hospital? Well, Part A is a deductible type program. You simply pay $1,484 per occurrence, and that entire hospital stay is covered at 100% for the first 60 days. Conversely, if you go to the skilled nursing home, the first 20 days of the skilled nursing home is covered at 100%. Additionally, days after 61 through 90 or days 21 through 100, there will be a small copay per day depending on which, if hospital or skilled nursing. You can see down below for those numbers. Part B. Part B is, or Part B covers medical services in the outpatient setting. Things like doctor visits, lab work, x-rays, ambulance, emergency room in the observation setting, and any kind of outpatient surgery. Part B is a 80-20 plan with Medicare paying 80% after you have met the 2021 annual deductible of $203. Now, Part B has a premium associated to it. Part B is $148.50 per month for most Medicare beneficiaries. It can be higher depending on your income, and if you wanted to check a video on that, I'll link it down below and have it flash here on the links that you can click on to see if you, or what will happen if you make too much money and have to pay what's called the IRMA, or the Income Related Monthly Adjustment Amount for Medicare. So these are common things that people think that is covered under medical, but is actually not covered under original Medicare. Original Medicare doesn't cover dental, vision, prescription drugs, more on that later, hearing, or help with long-term care, not to be confused with Medicaid, which is the nation's largest payer of long-term care. Medicare actually doesn't cover it. It only covers nursing home or skilled nursing care up until you can get better, or you cannot get any better. So if you need what's called custodial care, where someone has to help you take care of your, we call them ADLs, or your daily living activities. If you cannot do those and you cannot get any better so that you could do those, Medicare no longer pays for that medical treatment. You have to go to Medicaid, or if you have a long-term care policy or friends and family to rely on to help with that. Medicare does not cover custodial or long-term care. So if you're still working, or you plan on working beyond the age of 65, you can delay Part B, and that's if you're covered under employer group plan, or your spouse is working and he or she is covered under a group plan and includes you in their benefits. If you do that, you have no penalties and no loss of options. So what options are we talking about? Well, when you retire and you enroll in Parts A and B, you can either go to the Advantage route, the Supplement route, or you can go, if your employer has it, a group employer plan that has retirement benefits. Think of the federal government, or if your state that you live in has a retiree plan, or your city, some of them have retiree plans. Now, how do you know which one to go to? Well, let's ask some questions. So if you're on a retiree or a union plan, these are some of the questions you can ask. Sometimes, as I've found, the employer plan or the retiree plan is actually more expensive than getting private coverage out there. And this could be for a vast variety of reasons, but make sure you ask so that you know exactly what you're getting for what you're paying for, and see and compare to what you can get on the private market or in the regular marketplace. And if you do venture out of the coverage, make sure you ask about this question here. If you opt in, can I opt back in later? Because sometimes you want to know if you can get back, and some group retiree plans do not allow you to rejoin after you have left. Next route is the Medicare Supplement route. Now, Medicare Supplement is going to be more expensive. You do need to have both Parts A and B to enroll or to sign up for Medicare Supplement plan. The reason why they are more expensive is because you're buying more insurance. You have Medicare Parts A and B, you're paying for those, and you're putting something on top of that. Remember how I said Medicare for Part A, you have to pay that $1,484 deductible? Many of these Medicare supplement plans will pay that entire deductible for you. For Part B, 80% is covered by Medicare, 20% by you. A lot of that 20% is going to be covered by this Medicare supplement plan. Now, some things to remember. Medicare supplement plans are standardized by letter name. So Plan A is the same as all the Plan A's in the US. Now, that comes with a small caveat is there's about 4 states who run their Medicare supplement plans differently. The plans will still pay the same way that you purchase them for whichever state you purchase them in. Meaning all policies have to have the same basic benefits. Some of those plans that I spoke of will have bells and whistles, maybe some extra hearing, some dental, but the basic benefits of Medicare supplement coinsurance and copay amounts have to be the same based on that letter. And we can go into depth. You can see a video here where I talk more about the plan letters and which ones I think are going to be better for you depending on your circumstances. So, when is Medicare supplements the best path? Well, if you want to budget your medical costs, remember Medicare is a deductible for Part A and coinsurance for Part B. If you want to smooth that out and not have any surprises, many times you can purchase a Medicare supplement plan for about $150 to $200 per month and never have that $1,400 surprise or a huge out-of-pocket bill from, let's say, the ER or from some unplanned surgery. The Medicare supplement plan will pay for all that for you. Now, you do have to pay a little bit more per month to get that coverage, but it does help you if you want to budget the medical costs. If you want to travel to see any doctor away from home, Medicare supplement plans run off the original Medicare network. So you have really no network. You can see any doctor with no referrals, any specialist you want to see, as long as you can book an appointment, you're on their schedule and the insurance will pay. Some plans have no co-pays and no deductibles, which some people like, and you're assured once you get it, you can keep it so long as you pay. For Medicare Advantage plans, these plans replace Parts A and Parts B, and they can also include Part D drugs. Now we'll go into Part D a little bit later, but Medicare Advantage plans do include both Parts A and B, and sometimes D, in their benefits. Medicare Advantage plans typically have a network. Medicare Advantage plans are usually county-based or state-based, depending on the plan you choose. PPOs, preferred provider organizations, you can see doctors who are in the network without a referral typically. And if you venture out of network, things just might cost more. HMO networks, you have to get a referral to get any specialists, and you usually have to stay within the network of doctors or there's no coverage available. Now, Medicare Advantage plans also offer a maximum out of pocket. Something I didn't mention before about the original Medicare program is there is no maximum out of pocket. So, if you have vast amount of surgeries and hospital stays in 1 year, the cost to you is unlimited. In a Medicare Advantage plan, provided you remain in network and follow the guidelines of the Medicare Advantage plan, you may be capped at spending somewhere between $6,000 to $7,000 per year on medical services. So when is Medicare Advantage the best path? Well, if you want to pay a lower premium, many times these Medicare Advantage plans come to you at no cost. Sometimes they'll actually provide you with a Part B give back where they pay back some of your Part B amount if you join their plan. Many times you can use it as a backup for VA services. if you like the network of doctors. Some plans actually work with physician groups, and the only way to see those physician groups is to join their network plan. Also, if you are on a low income subsidy for Medicare, sometimes these plans work in tandem with uh, the low income subsidy programs or certain chronic illnesses that you can get a better plan with richer benefits than you could on the original Medicare program. Finally, Part D prescription drugs. Now, prescription drugs are covered by Medicare Part D. Prices vary by county depending on the plan, just like Medicare Advantage. This is provided solely by private insurance companies. So unlike Parts A and B, which you can still get from the federal government, Part D is only provided through private insurance companies. Just like Part B as in boy, you could be subject to late enrollment penalties if you do not sign up when you're supposed to. Veterans are exempt from enrolling in Part B, but you could do so if you choose to, drop in and out depending on your preferences. Next. Now, Medicare Part D can be very expensive, and for those folks who qualify based on income, as you can see here on the screen, may get help paying for some of those drugs, also paying for some of the premiums. Now, this is the top end resources amount, so if you make less than this per year, which is the 22,000 or 30,000 for couples, and have less than 14,000 or 29,000 in assets, you may qualify for extra help. And I suggest that you go ahead and apply if you fall within these guidelines, because Medicare unfortunately does not auto enroll you in these. Even though they have the information, you need to go and enroll. And there's a link down below where you can find out, or you can actually enroll right on the Social Security website. Another important thing about prescription drugs is prescription drugs have what's called the coverage gap or the donut hole. And even though they said the donut hole would disappear in 2020, what they did was they pretty much standardized the amount that you pay for drugs in the donut hole down to 25% for both generic and brand name drugs. Now you reach the donut hole when you yourself and the insurance company has paid out $4,130 in drugs. So if you go to the drugstore and your drugs only cost $5 per month, you will never hit the donut hole. But if your drugs cost $1,000 a month, total retail that you and your insurance company pay for, then by month 5 in May, you will have hit the donut hole, and now you have to pay for about 25% of that medical cost, for the full medical cost of that medication. Now, after you yourself have spent $6,550 in a calendar year, you will switch from having to pay 25% of the drug to paying 5% of the drug. So it does benefit you, but you do have that $6,550 buffer that you need to have saved if you're going to be one of these people who are taking these expensive medications. If not, either one, qualify for the slide before with extra help, or see if you can get a generic medication, or lastly, see if you can qualify for pharmacy assistance help, or the pharmaceutical company provides you with some sort of discount based on your income. So if you don't qualify for extra help, but the drug is still very expensive for you, you may qualify for the pharmacy company to give you help. All right, that was quite a bit. So how do you choose? Well, here's something I do for my clients that I can help you do, or you can help yourself by getting these things together and making a sound decision. You need to get a list of your doctors and your hospital. Make sure you look at all your medications that you take, including those that you take on a irregular basis or just once per year. Do you have any surgeries or other medical conditions that you need to be addressing in the following year? Do you have any copay concerns like high cost of the hospital, right? That $1,484 being a bit too much to handle in 1 month. What are you on now? Are you on a group plan where you don't really pay too much? Or are you on a Medicare Advantage plan where you're having trouble getting a doctor and getting services covered? What do you like about your plan? What do you not like about your plan? And what do you want to add to it? So what I do then is I take the data and I create a virtual presentation for my clients. You can send me this information, I can do it for you, or what you can do is you can look at these things and look online via either my shopping link or just look online on any of the insurance companies and see what kind of benefits are out there and make a decision that way. My services come at no cost and there's no obligation to enroll with me. I will send you my analysis, and that's kind of how I help the community and help my clients. And even if I can't help you, maybe I can help someone you know. Yep, then you enroll in the most suitable plan. And remember to get help. I know I said you can do it on your own. You can, but get help if you could. Because, you know, costs, we help you understand your costs. We help understand the benefits and mainly how to get the most of them. Convenience, we help you with claims. I've helped many of my clients get things approved, get authorization pushed through faster, and ask for the doctor to get cheaper medications. And of course, we assess your needs. Not that we understand you better, but we understand the plans. Usually we understand the plans a little bit better because we have a knowledge of all the plans that are in our areas. We also know how the plans change every year. Supplement plans, some of them have much higher rate increases than others. Some are more stable. Some plans offer extra benefits that aren't really spoke about because they can't advertise them. Right? We understand the plans. And what we, or what I want to do, is better understand you, which is why I need the information from that last slide. We work with your providers, your doctor providers. We make sure they're all in the network. And again, all of this is at no cost to you. So the decisions you make can impact your health for a long time. Now, Medicare is what most retirees are going to be on for the rest of their lives. And it's best to make the choice that's right for you right when you retire. Because a lot of these choices you can't go back on. Medicare supplements, for example, unless you enroll during your open enrollment, many times you have to get health underwritten before a new plan will take you. So it's very important to make sure you know what you're giving up if you don't enroll in a Medicare supplement when you turn 65 or when you have your open enrollment period, when that Part B starts. There's my information. I hope to hear from you or leave a comment below if you have any questions about this video. And I hope to see you guys in the next one.